25% of babies who have torticollis develop inequalities between their right and left sides, such as rolling to only one direction. So in this video, I'm going to help you teach your baby to roll in the opposite direction if they're only rolling in one way. Now, I have a buddy who called me up and he was like, "Hey Tim, can you come over and check out my son Noah? He's really only rolling in one direction towards his left, and I feel like something's wrong." And so when I get to their house, I see Noah there, and Noah's sitting in a swing. And when he's sitting in a swing, his neck was tilted towards the left and then rotated towards the right to look out a window. And just by looking at that, I immediately suspected, okay, he may have torticollis. And so I did some range of motion testing, and surely enough, he did have limitations in the neck consistent with torticollis. So next, I wanted to see how Noah was when he's on his tummy. And so I asked my buddy, let's place Noah on his tummy, and Noah immediately positioned himself so his left elbow was down and his right knee was up. And in that position, Noah's chest was facing right, his hips were open towards the right, which made it so much easier to end up rolling towards his left. Okay, so he can roll left. Now, I asked my friend, how about we put his arm and his legs in the opposite direction? So I watched my buddy try to put Noah on his right elbow, try to get his left knee up, so then Noah's chest would be open towards the left and his hips would be open towards the left. That way he could roll right. But if you ever watched The Revenant, it was like watching Leonardo DiCaprio take on that bear, except the bear was like 10x more intense. But in all honesty, I really do think that this is an area where families get really frustrated in trying to help their baby roll, because the baby doesn't want to be positioned like that. And then also the family is struggling to, I don't really know what to do with my hands, my legs, and it's just a crap show altogether. So I helped my buddy out, and first thing to do was, let's set ourselves up for success. So I recommended that we look around his house and find something that is like sloped down. That way Noah could have something to roll down, with supervision, of course. And we came up with a couple things. We took the couch cushions off the couch, we tried out the throw pillows, and then my buddy's even lucky enough to have one of those beds that he can adjust the head of the bed frame to, make an angle that way. Alright, so we got that. We have our slope surface. Next is to find something entertainment. And Noah really liked his VTech books, the ones where you press a button and then it plays this wonderful music that you never get sick of for listening for hours and hours and then hours and then nap and then more hours after that. You know what I'm talking about. And then I wanted to teach my buddy, what to do with his hands, what to do with his legs. So I asked my buddy, okay, how about we place your right knee on the outside of Noah's right hip and leg? That way it provides him some support there. How about you put your right hand right beside his arm and elbow to give him kind of a surface to tuck his arm underneath? And then also your left hand, let's use that underneath his left armpit to support his chest up, but then also rotate it out a bit. And essentially what that position does is open up Noah's chest towards the left and then open up his hips towards the left. That way he's set up to roll towards his right. And so we put it all together. Noah was placed on, we used the couch cushion. If it's fluffy in the middle, we kind of put Noah a little bit more on the right side. His dad, he put his knee right on the right side of him. He put his hands right on his right elbow with his arm tucked underneath. And then my buddy put his left hand underneath Noah's left armpit and rotated his chest up. And then I was in charge of using the toy. So I took the wonderful VTech toy, pressed some buttons to grab Noah's attention. And then once I got his attention, I started lifting up that toy. That way Noah would have to continue looking towards his left. And then once he hit his limit of range of motion in his neck, then he started to twist his trunk. And then eventually, when he rotated enough, he had shifted enough of his weight this way where he completed that roll finally. And when he completed that roll, of course, we rewarded him with claps, and he got to play with that VTech toy that he loves so much.
Here we go round the mulberry bush, the purple, blue, green, yellow, orange.
And if you find that your baby's having difficulty in either strength or flexibility, then check out my videos right up here. This one targets flexibility by showing you hands-on stretches, and this one down here shows you different ways to play to improve both strength and flexibility. I'm Dr. Tim, pediatric physical therapist, and make sure to hit that subscribe button to stay tuned to Tummy Time Academy's video next week.